Hi, my name's Ilana. I'm going to be your nurse practitioner today, and I see that we're going to be doing an assessment of the chest and lungs and cardiac. Any specific questions or anything before we get started?
No, I feel pretty good.
Okay, great. So at first, I'm just going to kind of inspect your chest, make sure that everything is looking like it's expanding the same on each side, so bilateral symmetry of everything. And then I'm also going to kind of just be watching you to look for your rate and rhythm of your respiratory sounds and how many times a minute you're breathing. So from what I can see, it looks like size and shape are symmetrical. The chest is expanding bilaterally symmetrically, so that's all good findings. It looks like your anterior, posterior diameter looks good. You look well nourished, no acute distress. I'm going to look at your fingernails and the tip of your nose and nostrils and make sure that there's no lack of oxygen that we can see, no kind of blueness, pursing of the lips, nothing going on. So nothing out of the ordinary like that you've been experiencing?
No.
Nope. Okay. So now I'm going to look and make sure that so that would indicate too there's no superficial venous pattern issues. Looks like you're well perfused, circulation is good. Your body's getting oxygenated well from your lungs. So then I'm going to kind of look at some anatomical landmarks. We're going to start with your trachea, so making sure that it's midline, and then I'm going to go down to your suprasternal notch. Check that out. Go down to the angle buoy. Check out the costal angle, C7. And just make sure that everything, there's no tenderness, nothing is painful, sore.
No.
Okay. Down around here in the clavicle. So it sounds like you're breathing easily with no distress. I counted about 14 respirations per minute. Normal is 12 to 20, so that's great. In terms of chest movement, it looks like everything's symmetrical. Expansion, like I previously stated. I'm going to listen to your lungs and see if there's any adventitious breath sounds, which is just anything abnormal, out of the ordinary. You haven't had any wheezing or anything that you've noticed lately?
No.
No cough?
No.
Okay. No sore throat or anything like that?
No.
Okay. So I'm going to go ahead and listen to your lungs. We're going to start in the front, and then we'll move to so I can listen from your back as well afterwards. Okay, so when I put my stethoscope to your skin, just take a deep breath for me, okay?
Okay. And hold it?
Just take one deep breath, and then I'll move to the next location.
Okay.
Okay, everything sounds good and normal, nothing out of the ordinary, no bronchi, wheezing, crackles, so nothing that would make me suspect consolidation or fluid in your lungs. I'm also going to have you do, say 99 for me when I put my hands to your skin, okay?
Okay. 99, 99, 99, 99.
Okay. So that's measuring for tactile fremitus, and there's a few tests that I'm going to do from your back side. So if I can have you turn to that side so that I can check out your lung sounds from your back. Okay, so I'm going to have you fold your arms in front, and I'm going to do that same 99 test. So when I touch your skin, say 99.
99, 99, 99, 99, 99.
Okay, great. So now I'm going to test for thoracic expansion, and this is where I'm going to go kind of down around your 10th intercostal muscle space, and I'm gonna put my thumbs in they're really tight. So when I'm gonna have you take a deep breath and breathe out, and that will show that if my thumbs go down symmetrically, then that means that it's normal, and that's what we want to see. So that looks normal. Okay, so now we're going to do a test called diaphragmatic excursion. So when I'm gonna listen, and when I'm gonna have you take a deep breath, and I'm gonna do 3 little taps, and after the 3rd tap you can exhale. Okay.
Okay.
So what this is testing for is making sure that the diaphragm, seeing how much inspiration and difference there is between inspiration and expiration from your diaphragm down here. Okay, so when I take a deep breath. Okay. So I'm seeing it right around here. And then now I'm going to get the other angle by doing it on this side, and it's going to be the same thing. Deep breath, and I'm going to do the 3 taps, and you can let go. So that's supposed to be no more than like 3 to 5 centimeters, and yours looks like it's right in the middle there. So that all looks normal. And now I'm gonna be doing some tests. These are specific to vocal resonance. So the first one is bronchophony, and I'm gonna be listening to your lungs while you say things, and then it'll determine if you have any fluid built up in your lungs. Mm-hmm. So when I touch my stethoscope to your skin, say 99.
99. 99. 99. 99. 99.
Okay, good. So those are muffled, which is what we want to see, which means that there is not consolidation in your lungs, because that would mean that the sounds were transmitted more easily with consolidation, and the muffling means that it's clear inside your lungs.
Okay.
So the next test is called whispered pectoriloquy, and this one I'm gonna have you whisper 1, 2, 3 while I listen to your back. When my stethoscope touches you, just whisper 1, 2, 3. Okay, good. So if I could have heard the whisper through my stethoscope while I was listening, that would mean that there could be consolidation in your lungs, which would mean that the sound transmits more easily. So those are both tests that can help with, say if someone has pneumonia, and make sure that they don't have a bunch of consolidated fluid in their lungs.
And you didn't hear that?
I did not hear that, so that means that you're normal. So the last one is called agopny, and what I'm going to do is I'm going to listen again to your back and make sure that there's no increase in intensity. You're going to say the letter E for me, okay?
When you touch with the stethoscope?
Yep.
Okay.
Okay.
E. 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 E.
Okay. So, importantly too, we're comparing both sides, making sure that neither lung, that they're the same on both sides, and making sure that in patients who have consolidated fluid in their lungs, you would hear that change from an E to an A. So since I heard the E, that means that you don't have that fluid in there.
Good.
So now I'm just going to do some percussion, and then some auscultation on your lungs, and we should be fairly close to being done. So when I'm percussing, you can just take normal breaths, and I'll let you know if I need you to take any really deep breaths. So again, areas that are resonant are going to mean that there's not a lot of fluid in your lungs. If there's areas that are really dull, that's where we'll see that there can be, consolidated fluid. In the setting of, lung issues, pneumonia, or, also with patients who have heart failure, that kind of thing, they can have some consolidation in certain areas. So lastly, I'm just going to listen to your breath sounds from your back, and then should be good. So again, take a deep breath when you feel my stethoscope, okay? Okay, so everything sounds great. No adventitious breath sounds like we found earlier on the front. No crackles, ronchi, percussion tones, or anything like that. No crepitus, no pleural friction rub. The tactile fremitus test was normal, and all of the vocal resonance tests were normal too. So good thoracic expansion, chest movement, normal respiratory rate and rhythm. So everything is looking good on the respiratory front. We're going to transition into the cardiac test. So I'm going to have you lay down.
On my back?
Yes. So have you noticed any issues with your heart lately? No palpitations, feeling like skip beats, or anything you can think of?
No.
Okay, well then I'm just going to do the normal test and we'll just see how everything's looking. So nowadays they do a chest x-ray usually when they're going to be trying to figure out the size of your heart. I can listen for it. It's not as accurate, but we can kind of get the visual outline of things.
Okay.
So I'm going to just kind of percuss in the normal areas, and we're going to see if we can kind of get this outline of your chest. Okay, so I'm seeing that it looks like it's normal shape. Again, the chest x-ray would determine if there are any issues, but in terms of anatomic markings, I think everything looks normal and size-wise in terms of percussion. So then I'm going to be looking, I'm going to be listening to your heart from a couple different angles. So we're just going to start at this point. I'm going to listen for S1 and S2, which are your two heart sounds. You've probably heard them say love dub, which is the doot-doot of your heartbeat. So while I'm listening to S1 right here, I'm going to also feel your carotid pulse because that's going to correlate. So I'm going to listen to your heart from here, and so just breathe normally.
Okay.
So first I'm going to start with the aortic valve, which is in the second intercostal space on the right sternal border. And then I'm going to move to the left sternal border in the second intercostal space, which is where the pulmonic valve area can be heard. Then we're going to move down between the third and fourth intercostal space, which is what they call Erb's point. And that's where the tricuspid valve can be heard. And then we move down to the mitral valve area, which is the fifth intercostal space on a mid-clavicular line, and that's where the mitral valve can be heard best. So when you're listening, you want to make sure that if you're in a specific area and you hear a murmur, that that's potentially where that could be coming from. Not that you have that, but just explain that. And then down here is called the point of maximal impulse, and it's where you feel where your chest beats the strongest. It's right there.
The heart beats the strongest.
Yeah, hard, yes. So I'm going to take a listen. Okay, everything sounds great. No abnormal heart sounds. So normal S1, normal S2, which is S1 is systole and S2 is S1 S2 is systole and S2 to S1 is diastole. So the filling of the blood in the heart versus the ejecting of the blood in the heart.
Okay.
Filling is diastole, the ejecting is the systole. And you can, some people can have abnormal heart sounds like an S3, which they call a gallop, or an S4. And those are usually indicative of, something going wrong, but you don't have those, so that's great. No murmur, nothing that I can hear that sounds out of the ordinary at all. So, no pulsations, heaves, lifts, didn't hear any thrills. Your S1 correlates with your carotid artery. I'm going to listen for carotid bruit. So nothing there, so that means that there's no turbulent blood flow going on. And then I would normally look and see if you had what your jugular venous pressure is. So we kind of look at the jugular venous right here, so the vein. And luckily, it doesn't look like you have any built-up pressure. We'll see with fluid overload and higher fluid volume patients, they may have a higher up one that you want to test and measure. Since yours, I can see it just above the supraspinal notch, suprasternal notch. I can see that it's normal, so I'm just going to call it normal for now. But if it were elevated and I saw that, I would measure it and put that in my assessment notes. So everything looks good on the precordium. All your sounds look good. Normal heart size. Listen to the heart, the rhythm and rate look normal. I'm going to have you turn onto your left lateral recumbent side because that's where the heart's going to get the closest to where I can hear it and feel it right here. And that'll be the last thing that I want to do, just to listen to it one more time, make sure everything is looking great. So if you want to get onto your left side.
Can I get a drink of water?
Yeah.
Okay. Just take that here.
Okay. So just so that, so you're comfortable and you're laying on your left side. And then that way I'll listen to your heart and be all set. Okay. So same thing I kind of did when you were lying down, just I'm going to listen to it from this angle because this is where we're going to be able to get the best sounds and feels in there. So again, in the same areas. Feeling for that point of maximal impulse right there too. Okay, great. And again, everything looks normal and sounds excellent. No abnormalities that I can see, so I think you're good to go on your heart and lungs.
Good.
Do you have any questions?
No. I think there were a lot of terms I didn't understand, but you explained some of them.
Okay.
Yeah.
Okay, well, thank you so much.
Thank you. Nice meeting you.